Thank you for tuning in and joining us for another episode of Help Nobody Told Me. I'm Jasmine Shapiro. I'm with Berkshire Hathaway Home Services. I'm a realtor here in the North Shore. Here with my co-host, Jordan Kagan, the man of silver.
Welcome, everybody. I'm glad to have you join us today. And I am active with the Northbrook Chamber of Commerce. And this past month, I got to meet Dr. Jessica Marabella. And as our senior resource team, for months we've talked about trying to have someone with a medical background. Because, we're in a society that tends to write a prescription to treat something. And it's so much more cost effective. And it makes us feel better if we can prevent a problem. So when I heard Jessica talking about her method of operation, her MO, and how she takes on medicine, it was really exciting.
And you're a concierge doctor, right?
I am. I just opened up my practice, Blossom Family Medicine, because I really wanted to be able to offer my patients a different way of medicine,
Elaborate on that.
So
How do you differ than a typical doctor's office or philosophy?
And you probably were in regular practice.
I was.
Prior to opening up your concierge practice.
Yes. So for the last a little over 8 years, I was in the traditional family medical practice. So I had almost 4,000 patients assigned to me. We'd spend I had 15 minutes per patient. It was really, you come in, you have one problem or you're physical, and we'd have to just really quickly address it, and then I have to go on to the next patient. A lot of times I was running behind, it felt rushed, and I felt like I wasn't giving that care that I really wanted to do it. I went into family medicine because I wanted that continuity of care. I wanted to see you when you were sick and when you were healthy. I really wanted to see the whole family. I see kids and I see adults. And I felt like I wasn't giving that care that I really wanted to give. A lot of times they only could see me when they were healthy. And when they were sick, I didn't have any slots open to them because I had so many patients. So I was trying to brainstorm, what could I do differently? So that's when I decided on concierge medicine. Concierge medicine allows me to have longer appointment times with all of my patients. I have a limited number of patients. So the max number of patients that I have in my practice is about 250 to 300. So every patient gets at least an hour, sometimes 2 hours to spend with me, and then they have that direct access to me. Mm-hmm. So they never feel rushed. They know they can call me, text me, email me, and it's that they can see me when they're sick, they can see me when they're healthy, and we have that great connection. And I'm truly their partner in health. So
I think so many people are frustrated with our healthcare system in the United States. And it's not the doctors or the medical professionals' fault. It's more like it's run like a business nowadays instead of as an actual healthcare providing opportunity.
Yes, and as doctors, we didn't go into medicine thinking it's going to be such a business.
Right.
And that's what we're so frustrated with, and a lot of us are just, we complain, and unfortunately, we're not the ones in charge of it.
No.
And that's why we're leaving and opening up our private practice.
Right.
It's going the other way, where the hospitals were gobbling up practices, those that are fed up with the big hospitals and big medicine. Now, some of them are going another way, saying, opening up a private practice to give the care they went to medical school for.
Right. So hopefully it swings back the other way,
right,
so we can give the best care for what's good for our patients.
And in concierge medicine, do you take insurance?
So there's different types of models. So my model for concierge medicine, we don't accept insurance to see me, but we use insurance in a different way. We use insurance to cover all the expensive stuff. So like MRIs, CAT scans, if you need a specialist. But anything that you do with me is all covered under that membership model, a membership price.
Okay.
But
is that how most concierge?
That's how most are kind of like switching to now. Yeah. There's some concierge models that are still affiliated with the hospital system, where you still do a fee for service, where you still are using your insurance, and on top of it, you're paying a membership But I felt like that was almost like double charging, so I didn't want to do that for my patients. I wanted to just do a flat rate, and then no surprise fees, no surprise charges. You know exactly what you're paying, and then that's it.
And if one of your patients is hospitalized, are you able to go to the hospital and see them?
So I can go see them, but I usually have the hospitalist round on them, but I'm coordinating care with them. I know exactly what's going on. I have access to their chart, and it's great because I have that connection afterwards. They come right to me, and we pick up and make sure that they have that connection afterwards.
I think that's a misconception. I think people don't understand that you do have access to their chart.
That's the biggest thing is I make that smooth transition. When they leave and choose me, I can get all their records for them. I can see everything, and I make that transition super easy for them.
Yeah.
We don't have to...
You're not reinventing the wheel starting from scratch.
So I think a lot of people don't know about being a medical advocate or a patient advocate. So when I have learned about that the last 10 years or so, 15 years, I normally think of a family member being someone's patient advocate. Do you officially or unofficially, when they are in the hospital, are you their advocate?
I can be, you know, so it depends on how much you want me to be involved in your care, you know. Some of my patients, they just let me know that they're in the hospital, and then they go, I'm just gonna let you know when I'm out. Sometimes they want me just to kind of be involved with the hospital that's there. It all depends on why they're there, what's going on. I had this one patient that was in the hospital, and they let me know, like, oh my gosh, they found a nodule that's on my lung. They said I have to see an oncologist right away when I leave. And I was like, wait a minute, let me take a look in your chart. You've had that nodule there for 10 years. It's nothing new, but they just didn't have access to their chart.
To your history.
Exactly. Yeah. So they're like, oh my gosh, thank goodness. It's a peace of mind. I know you so well.
Right.
They thought they had to go see an oncologist. It's a new diagnosis. But again, I have full access to your records. I have everything.
And you have the time now.
Right.
Because you are a concierge doctor, so you have the time to actually devote to it, or before you weren't given that time.
Exactly. And so I can walk you through every step. And especially after a hospitalization, they give you like a full stack of papers and go, here you go, bye.
Yeah.
I go through and I pretty much like go debrief and go, okay, this is what happened. This is what we need to do afterwards. And this is the meds that they changed. So it's nice. You have a doctor that's managing you after a hospitalization, and we make sure that we're not missing anything, because you don't want to be taking the wrong medications. You don't want to go back in the hospital.
Right.
So
what would be the largest age population that decides they want to use a concierge doctor?
I feel like there's two groups. So there's a younger group that's probably between like 40 and 55. They're like the busy working population. They have, they're managing their family, they're working, they're busy. They don't want to be sitting in waiting rooms. Their time is valuable, and they want access to their doctor right away. And they're kind of fairly healthy, but they want to be proactive. And then there's that second group that's a little bit older generation. They have a little bit more chronic health conditions, and they need that extra help. So that's where I kind of come in and kind of like almost handhold them a little bit closely. I have the time to kind of help manage if they need to go see a specialist. I help them get in with that. I also help, I call myself almost like the quarterback for them. I kind of explain to them the difference, why that cardiologist is managing that medication, why they're changing that for the urologist. So there's two different
groups.
groups.
There's a trust factor there, because you will be seeing so many different doctors maybe for different issues that may arise, and you don't know that person.
Right, and they only have 15
You're the
minutes.
Constant, right?
Yes.
So going back to you and saying, I'm really frightened, I don't know what this means, and you can break it down and manage it.
Yes, I have one patient that sees a urologist. He has a lot of kidney stones, and he's just like, the urologist did not really explain to me why I'm on this medicine still. And I debrief with him. I go over it, and then he's like, oh, thank goodness. Like, I just felt like I was rushed there. And I'm like, I understand, they were doing what I was doing and they don't have the time, but that's why you have me, and I can explain that to you.
And we kind of developed this podcast because we wanted to inform people about various things as we age and we transition in life. And I think that 40 plus age group that you were describing, they're watching their parents and they're seeing what's happening, and they want to take a better approach in managing their health care and transitioning to getting older. So let's get a jump on it now.
Right. It's all the latest trend right now is like that longevity. You know,
And we are living longer, right?
Right, exactly. We have better medicine. We're taking care of our health. We're being proactive. It's all about, again, prevention.
So you specialize in women's health and obesity medicine too. Talk to us a little bit about that, because that's a big thing these days.
It is. I love women's health. You know, I felt like for a while women's, issues were kind of just being brushed off, telling them that their symptoms are normal, it's okay, their regular periods are okay, it'll just normalize. And so for now we have the time to really dive deeper, figure out what's going on with them. I really let them know that it's not all in their head. Let's figure out what the root cause is. Is it hormonal? Is it thyroid? We check their metabolic panel. So we really dive a little bit deeper at Blossom, make sure that nothing else is going on.
And are you there by yourself? Do you have any partners, or are you able to manage all of this on your own? It seems like a lot.
It does, but it's just me right now.
Okay.
I plan on hiring another physician within the next year.
Okay.
But yeah, I just wanted to kind of get things started, get my patients
So
situated.
this is new?
Yes, I just opened up in January.
Oh, wow.
I've been in practice for now a little over 12 years.
Okay.
But
the concierge private is since January.
Yes.
Okay.
Yes.
Oh. Yeah, very
The
cool.
light bulb went off. Let's talk a little bit more about women's health. So, from my experience, no, I've not gone to medical school. I don't really want officially to play a doctor on TV. But when it comes to heart attacks, society, in my opinion, knows what symptoms are because of what a man experiences. Do women have the same symptoms for a heart attack as men?
Not necessarily, no. And that's usually the biggest misconception. So it's still one of the top leading, women die just as often from heart attacks as men do. So a lot of times women present as heart attacks more as like acid reflux or like nausea. So a lot of times we don't.
And back pain too, I think?
It can be, yes. So a lot of times we don't necessarily notice that we're having a heart attack. 'Cause in our mind, not as physicians but as common people, we think chest pain, arm pain going down the arm. So if we're just thinking like, oh, I'm just having some acid reflux, heartburn, nausea, it can't be a heart attack. But that's why it's really important to find a doctor that you trust, a primary care doctor that's screening you for risk factors, checking your blood pressure, checking your cholesterol, making sure you know your family history. So that way, if you have these symptoms and you're in that age, that you're not just being told, oh, it's just acid reflux, don't come in. You can make sure you catch it.
Thank you.
So can we go back to the weight and wellness?
Yes, please.
Because you didn't touch on
I'm sorry,
that.
I forgot the obesity medicine.
That's okay, but I know that's so, it's everywhere.
It
Social
is.
media, the news, everything
Yes.
is Ozempic and all of these weight loss drugs, and it's really sort of a craze now.
It is. So obesity medicine is such a huge topic. I love that because for a while, people just thought like it's just willpower. You can just lose weight by just willpower. But weight is so complex. It's influenced by biology, hormones, sleep, even medications can affect it. So too many patients have been shamed by this. And so a lot of times, a lot of people don't even tell that they're on Ozempic or anything like this because they're ashamed that they're losing weight by the help of medication. But it's such a great medication if you're on it for the right reasons and you're applying lifestyle changes with it as well. because it's shown to help reduce cardiovascular, helps reduce sleep apnea, and people are feeling great on it. So, if you're taking it and being managed by a physician, not just a med spa, and there's evidence-based behind it. So I love these medications, and I do it at my practice. But we usually work really closely with my patients, and so we don't do any judgment, and we really care for our patients.
Right. And then do you counsel them and the nutrition piece of it
Yes,
too?
we do.
Okay.
So we have the time to do that, and I also work closely with a couple of nutritionists that help me as well.
Yeah.
So. And then for women specifically, also make sure that they're doing some strength training, because as you get older, you lose that bone mass, so, and then menopause is a whole other topic, hormone replacement. Yep, we do that as well.
Wow.
So yeah.
So it's a whole person approach, huh?
Yes, we look at everyone as a full body picture, whole person. We make sure that's where that time comes into place. So we take the time to really figure out what is your biggest issue, and then why are you feeling that way, So is it that, okay, you're feeling tired, but why are you feeling tired? Is it because of hormones? Is it because you're not sleeping well? Is it because you're not eating properly? Same thing with obesity. Why can't you lose weight? Is it genetics? Is it that you're not, again, sleeping properly, causing your stress hormone to go high, and that causes anxiety, which causes you to eat more? So it's a big circle, but
Right.
we have the time to sit down and talk about it to break that circle.
So it's not one pill fits all. Sorry.
Right. And it's nice because, again, I hold you accountable. We talk about it and we figure out what works for you. I'm kind of like, I love being called like your partner in health. I'm not just a doctor that goes, here you go, good luck, bye.
Right.
And I know we've talked about it before, but as we're talking about preventative medicine and Ozempic, 1 out of 3 adults in America is pre-diabetic. So it's about 100 million adults are pre-diabetic. 90% of them don't even know it. So for those that are overweight, also more prone to diabetes, something like Ozempic can literally prevent them from becoming type 2 diabetic, and all the other things that happen with that.
Right, again, that's the prevention, being proactive. Medicine right now has unfortunately switched to the reactive. So we're trying to put out fires when we really should be ahead of it and figure out how do we stop it and get ahead of it. So that's what we try to do at Blossom.
So what are 2 to 3 preventive screening tests that people skip that we really should be paying attention to?
So I probably would focus on, the first one would be probably blood pressure screenings. High blood pressure is one of those silent changes. So a lot of people don't know when they have high blood pressure. It can cause heart disease, strokes, other cardiovascular diseases. That's a simple screening. You just come in, check your blood pressure. The other one would be cardiometabolic panel. So that checks your insulin, checks your sugars, checks your cholesterol. And then the third one would probably be for women, pap smears. A lot of women push that off. They don't like to get pelvic exams or pap smears, but it screens for cervical cancer. And that's a great early detection. So if we catch that early enough, we can prevent it.
And how about for men?
Blood pressure.
Blood pressure,
cholesterol.
blood pressure, and then prostate would be another one. But now we do that more so with questionnaires and PSA. Colonoscopy is a huge one too. We start that now as early as 45.
Okay. I've had mine.
Good. Check.
So you really sound incredibly passionate about your work, helping people, empowering them, being their partner. What's one thing you wish every patient knew?
Probably that you don't have to feel just sick, You should feel well. It's not, you don't have to feel tired, you don't have to feel stressed, and you should be able to advocate for yourself. Finding a doctor that listens is important. So finding don't just stop and be like, oh, it's okay, I'm just going to feel like this. Finding someone that truly listens to you, is, I feel like, so important. And, whether it's me, whether it's someone that you find that connects with you, ask questions, be proactive. I feel like that's the most important thing. I can't stress that enough.
So how can our listeners connect with you or learn more about Blossom Family Medicine?
My website, blossomfamilymed.com. I'm on social media. I have Instagram and Facebook at blossomfamilymed.com. Blossom Family Med. You can set up a free consultation with me as well.
Okay, well, and we will link all of that to our show notes as well, in case somebody's driving and can't write that down. So we will do that. And if you're not living in this area and you want to find a concierge doctor, what would be the best way to do that?
So there's two ways. There's actually a free search. They're called direct primary care. They usually are how you find a concierge doctor like me. They don't always call themselves concierge doctor, but they do the membership based like me. Or just typing in your Google search, concierge doctor near you, and it'll probably pop up.
Okay. I think this was great.
I think so. I hope people have learned something today. I hope they maybe found out something that they just never even knew to exist. And,
there's options
sometimes
for us
to say,
Yeah.
and it's okay to say, help, I need help, or help, nobody told me. And with that is another wrap of this podcast episode. And
please subscribe, follow, share this episode to anybody who that might be interested in either connecting with Dr. Jessica or looking for a concierge doctor that doesn't live in this area. And tune in next week for another episode
of Help Nobody Told Me.
Thank you for having me. This was so fun.
This was great.